All right, guys. Well, welcome to our Let's Talk About Poop. I always mess up in the very beginning. I don't know why. Let's do this again. Howdy, y'all. Welcome to our Let's Talk About Poop podcast, where every Monday we go live and answer questions you guys have. We also have a deep dive in which we go into a topic as well. So if you're joining for the first time, my name is Dr. Islam. Who am I? I'm a board-certified gastroenterologist trained at the Mayo Clinic. I've been doing this for over 10 years. I've treated thousands of patients and written papers all about the GI tract. If you're new to this channel, don't forget to subscribe to my channel, listen to our podcast, watch our live stream as well. So the way we do this podcast is that I go through a deep dive on a couple of topics that patients have asked me about during my week as a gastroenterologist. And towards the second half of the podcast, if you're on my live stream, I answer any live questions you guys have as well. So if you haven't already, don't forget to like what you see, like what you hear. Let me know where you're watching this, if you're watching this live or on the replay. And also let me know what social media stream you're watching this at and where you guys are watching this at as well. So today, we're going to do a deep dive on a couple different topics. We'll talk about Barrett's esophagus. We'll discuss 3 ways, easy ways to add in fermented foods and why you should do this. And have you ever noticed you have a cyst on your bottom? What are reasons for that? And also, what can you do to make sure that's doing okay? So without further ado, let's do our first topic, Barrett's esophagus. So I got this question today because I actually had a patient come see me who just got diagnosed with Barrett's esophagus. He had a lot of questions about exactly what was going on. He was like a 50-year-old male having chronic acid reflux for a long time. Nothing really worrisome. He was just wondering why he was still having issues with his esophagus. And so we actually did an upper endoscopy, and we actually diagnosed him with this condition, which is called Barrett's esophagus. So what is this? So Barrett's esophagus is a precancerous lesion of the esophagus that over time has the potential to go into esophageal cancer. In fact, Barrett's esophagus is the highest risk factor for progression into esophageal cancer. The reason this occurs is that you have 2 different cells kind of within your upper GI tract. You have cells in your stomach called columnar cells, and you have cells in your esophagus called squamous cells. Now, the cells in your stomach love acid. They don't care. They can bathe in acid. Not a big deal. It's because they have these columnar cells, or we have these columnar cells in the stomach that are normally made to hold on to acid and to not have any significant complications from that. The issue that occurs with Barrett's esophagus is that when the acid actually goes into the esophagus, your esophagus is not like acid. It doesn't like it. And over time, those squamous cells inside the esophagus can actually get converted into stomach-like cells because the cells in the stomach are the ones that can tolerate acid. But the issue in Barrett's esophagus is that that transformation from normal esophageal cells to stomach cells does not stop. In fact, the transformation keeps on going and going and going to the point where it can actually become cancer inside the esophagus. And this is actually what Barrett's esophagus come from. So whenever we have somebody who has Barrett's esophagus, the way we know this is that the way we diagnose somebody with Barrett's esophagus, that involves 2 different things we have to do. Number 1, I have to visually see what's going on. So we do what's called an upper endoscopy or an EGD. This is a procedure when we put you to sleep. We use a very small camera, and I can take a look inside the upper GI tract to see exactly what is going on. And with that, I can assess, do you have Barrett's esophagus? What is the extent of that? Are there precancerous cells in the esophagus, or what is going on? When we see that, we also need to confirm that with biopsy. So we actually need to see that transformation of those cells from the squamous type cells to those columnar cells that are typically seen within the stomach. So how do you know if you have Barrett's esophagus? Well, there are kind of 6 symptoms that bring up a red flag that may make me think you have something going on in that esophagus. So number 1 is that you can have trouble swallowing, so difficulty swallowing. So trouble swallowing is never normal. And anytime you have trouble swallowing, you need to make sure you don't ignore that, because that could be a problem going on. That could be a sign of that condition called Barrett's esophagus. Chest pain. Yes, chest pain can actually be due to your esophagus. In fact, the second leading cause of chest pain besides the heart are issues going on in the esophagus, whether it's reflux, Barrett's esophagus, or even spasm as well. You also have regurgitation of food coming up. That is a classic definition of heartburn or GERD, which can also lead to acid reflux. Chronic cough, coughing all the time. We don't quite know why. You have a normal chest X-ray, you have a normal asthma test, you don't have COPD, you don't know why. Chronic cough can be due to chronic acid reflux, which can also lead to Barrett's esophagus. And then having hoarseness of the voice, same thing. That acid goes up into the voice, the vocal cords, to cause your voice to become hoarse as well. However, the most common symptom of Barrett's esophagus is chronic acid reflux. Absolutely. In fact, acid reflux is the number one reason why you can get Barrett's esophagus. And so what we need to do is we actually need to make sure we can do that. Now, there are three main reasons why you can have Barrett's esophagus. So the first one, obviously, is chronic acid reflux. So if you had reflux all the time, or even if you have reflux intermittently, this can predispose you to have Barrett's esophagus. I've had patients who come to see me who say, hey, Dr. Issam, I have the occasional reflux. It's not all the time, but it comes and goes. They had other risk factors for Barrett's esophagus, which we'll talk about. And because of those risk factors, we decided to take a look with an upper scope. We actually found them to have Barrett's esophagus. So besides reflux, what are some of the other risk factors for acid reflux? Well, number 2 is obesity, especially central obesity around your belly. Having a big belly, a Santa Claus type belly, a beer belly, will predispose you to have acid reflux. That pressure can actually make more acid go up into the esophagus, cause worsening issues to occur. Number 3 also is being a middle-aged Caucasian man. That is the epitome of somebody who will get esophageal cancer and Barrett's esophagus. And then lastly, smoking will certainly predispose you to develop Barrett's esophagus. So the way we diagnose it is that we take a look with an upper scope. And let's say you have this diagnosis. How do we treat these patients? What do we do to treat patients who have Barrett's esophagus? Well, the mainstay of treatment really comes down to acid reduction therapy. And the best medication, in fact, the only medications that have been shown in clinical trials to decrease your risk for developing Barrett's esophagus are proton pump inhibitors, or PPIs. So H2 antagonists have not been shown in clinical trials to decrease your risk for Barrett's esophagus. Antacids have not been shown in clinical trials to decrease your risk for Barrett's esophagus. Other things have not been shown. They can help, but by far the mainstay of treatment are PPIs. And actually, having Barrett's esophagus is one of the very few reasons why you have to be on a PPI. I know patients ask me all the time, hey, Dr. Issam, do I have to be on a PPI? Is it safe? Do I need to worry about this? What if you have Barrett's esophagus? My discussion for you is not should you get off of it, but we need to continue on this as long as we can, because this is the only thing that's been shown in clinical trials to prevent the risk of this progressing into esophageal cancer. Number 2 is that sometimes lifestyle changes can help out. So changing your diet, having more of a Mediterranean type diet, adding fiber, adding healthy fats, trying to minimize the processed foods and fast foods are going to make things better as well. Number 3 is losing weight. Like I told you before, obesity is a risk factor for developing Barrett's esophagus. So losing weight in any way that you can is going to make things easier for you as well. And then also too, lastly, but also significantly important, is making sure you get your routine EGDs. My patients who have Barrett's esophagus typically need routine EGDs depending on the style or the degree, and the length of Barrett's esophagus, and whether there's precancerous cells or not. And that routine EGD is going to be the thing that will prevent this from progressing any worse in the future. It's also going to be the thing that's going to prevent this from progressing into cancer as well. So mainstay of therapies, acid reduction therapy, lifestyle changes, losing weight, change your diet, and getting routine EGDs done. Now, if you have Barrett's esophagus, I would encourage you to go see a GI doctor, someone like me, so we can see what's going on, make sure it's doing okay, and hopefully get that taken care of you. Unfortunately, Barrett's esophagus is very common. I see this all the time. And unfortunately, I've had a good number of patients who we had the opportunity to prevent them from progressing into esophageal cancer, but there are those in which they did not do their routine surveillance EGDs, their upper scopes, and because of that, they unfortunately progress into cancer of the esophagus. And it's something I don't want for you, nor do you want for yourself as well. All right, next topic, fermented foods. All right, it's very hard for myself, and I'm sure for you, to add in new foods. So in this part of the podcast and the video, I'm going to discuss exactly different ways to do it. We'll discuss exactly what are the reasons, what are fermented foods, why do we even care about adding this, and I'll give you some simple, easy ways, 3 easy ways in which you can incorporate fermented foods into your body. So what exactly are fermented foods? Fermented foods are foods that actually contain live bacteria in them that can actually be added to what you're eating as well. So we need this bacteria to help adjust our gut microbiome. There's a constant battle in our gut microbiome between the good guys and the bad guys. And commonly, for a lot of my patients who have gut issues, the bad guys overwhelm the good guys to cause bloating, distension, nausea, SIBO, gastric reflux, heartburn, all these other conditions that are there. And we need to do what we can to make sure the good guys in our gut can win and to save the day as well. And so by adding fermented foods, you're able to do that in a very natural and effective way. And the healthier your gut microbiome is, the healthier you're going to be as well. And the more diverse your gut microbiome is, the more diverse your health is going to be as well. But that's not the only benefit, because fermented foods also have a lot of vitamins, nutrients, minerals to help improve your overall health and get you feeling better as well. So I'm a big component and proponent of adding fermented foods to every single meal that you can. So here are 3 ways that you can do that. Number 1, I would recommend for you to add either kimchi or sauerkraut to any salads or sandwiches that you're eating. It's easy. Use this as a garnish on the other garnish that you're having. These are basically just cabbages that you're adding, or fermented cabbage that you're adding to your food. And so if you can do this, add this to your salads, add it to your sandwich. It's an easy way to hopefully change your gut microbiome and not make a significant change to your overall habits as well. The other good thing about adding kimchi or sauerkraut is that it actually has ingredients in there to lower cholesterol and to lower insulin resistance, which will make things easier for other conditions, including diabetes. Tip number 2, I recommend adding yogurt as a sauce. Yes, you can. Marinate your chicken in yogurt or have it as a dipping sauce as well to dip in your fruits and vegetables. Yogurt actually has bacteria in them, and the bacteria can also change your gut microbiome as well. So it has those probiotics, but not only that, it also contains phosphorus, vitamin D, calcium, and other ingredients and vitamins and minerals to improve your gut microbiome. So use yogurt as a dipping sauce or a way to marinate your food as well. Tip number 3, make a cheese board. Absolutely, this will work. Cheese, especially certain cheeses that are fermented, can give you the good probiotics and the prebiotics that you need to improve your gut and your GI tract as well. So these include cheeses like Swiss, provolone, aged cheddar, Gouda. These are very nice, tasty, and fermented cheese. Not all cheeses are fermented. So Kraft cheese is not fermented. Macaroni and cheese is not fermented, but these other cheeses are fermented. And so if you can add this will help improve and change your gut microbiome as well. And by doing this, they're very simple ways to improve your health, to get you feeling better, and to at least add something into your diet that otherwise you may be missing as well. All right, now going to our third topic, a cyst on your bottom. I got this from a patient who I saw last week. Hey, Dr. Islam, I have a cyst on my bottom. What is going on? And what are the symptoms that you need to kind of be aware of that you may be having a cyst on your bottom? So let's talk about this. So we'll talk about exactly what exactly is a cyst in your bottom. We'll talk about what the cause is, what are some of the risks, and towards the very end, I'll talk about the treatments that I would recommend as a poop doctor to get this cyst taken care of for you. So what exactly is going on? When you have a cyst on your bottom, a cyst on your butt, this is basically an infection that occurs within the creases of your bottom area. And this typically can happen when you have a hair that's clogged up, you have skin cells that are irritated, or you have some sort of dirt that's clogging up a follicle. This will cause that cyst to occur inside that bottom area. Now, what are the symptoms? How do you know if you have a cyst? Well, number 1, you could have some tenderness whenever you're standing or whenever you're sitting for a long time in your bottom area. That tenderness could be a cyst that has that blockage that's there. Number 2, you can have some redness in that area as well, some warmth, just some irritation that's there that you can notice, especially if you kind of feel in that area. It feels a little tender in that area. Number 3 is that you can actually have some pus that drains from that particular cyst that may smell, not very good. And that pus could be an infection that's from that cyst as well. And then if you have systemic symptoms, you also have fever and flu-like symptoms that can occur from this cyst as well. So why do people get these cysts on their bottom? To be honest, we don't quite know exactly why that's the case. There may be it may be multifactorial as to why people can get that cyst on the bottom. So for some people, that area in your bottom can be an area where it's very vulnerable, where you have a lot of bacteria that's there, a lot of dirt that's there, it's not very clean. Another reason that it's also an area where you have a lot of pressure. So if you sit for a long time, or you're in a situation where you really can't move, that can cause irritation, things get clogged up, and cause that area to become a cyst as well. Now, there are certain risk factors that we have seen that can make it more likely for you to have this cyst. So, for example, if you're obese, if you had trauma to the area, if you sit down for a long time, if you don't clean that area, if you have a lot of hair around your bottom, this can predispose you for developing more cysts in that bottom area to cause issues to occur. Now, if you are having a problem with the cysts in your butt, what can you do? Well, so number one, come see someone like me, where we are butt experts, to see exactly why you have that cyst. So there are some non-surgical treatments. There may be some surgical options that we can offer for you. So for the non-surgical treatments, you got to remove that hair in that area. If that hair is matted, if it's too hairy, if things are getting stuck in there, you just got to remove that hair to make it easier for you. And sometimes we can give you medication, sometimes oral antibiotics or topical antibiotics. We can give you antiseptic washes. We can maybe use some injections of some steroids to hopefully cause that cyst to be reduced and to make it easier for you as well. Also, too, we actually may need surgery to remove that cyst. So whether it is an excision of that cyst, unroofing of that cyst, or sometimes even cutting it out, that can be a way to get that taken care of you. And so if you're having issues with these cysts or you're having symptoms, come see someone like me where we can actually take a look and see what's going on and maybe do the treatment there or refer you to somebody who can do that. So if you're watching this video, you're wondering, oh my gosh, I do not want a cyst in my bottom. What can I do to make sure it doesn't happen? So there are a couple of tips I'm going to recommend for you to make sure that you don't get a cyst. So number one, avoid prolonged sitting and avoid prolonged, just sitting down for a long time. And so if you're able to get out and stretch maybe every hour or so, that's going to allow you to not have the pressure on your bottom to cause that cyst to occur. Number two, try to manage your obesity. So if you're obese, this will predispose you to have more cysts. And so try to do what you can to minimize just the weight around the belly as well. Number three, you want to clean and exfoliate the skin around that area. Keep in mind that cysts can form because you have dirt in that area or a hair follicle is just clogged up. So try to clean and exfoliate that area. And then next, try to trim up that area as well. If it's bushy and a lot of things are going on there, you can't see anything, it's like a jungle in there, just cut some of that hair out and keep it clean as well. And also make sure that you avoid clothes that are very rough in that area. So like denims or things that are tight, that's going to make it more likely for you to have any issues going on in your bottom. So if you have a cyst in your bottom, come see me. We can find out what's going on and hopefully get that cyst taken care of for you as well. All right. I think that's all we got for today. I want to thank you for watching. If you haven't already, don't forget to smash that like button, like, share, and subscribe. If you like what you see, if you like what you hear, give us a 5-star review, subscribe to our channel, and come see us at the Gastro for all your GI needs. So thank you for watching. Hope you guys have a great day. Look forward to seeing you guys next week, and hope you guys are doing well. Thanks and take care.